Welcome back, dear uncles, aunts, brothers, sisters, and friends, to the Everyday Life channel, a place where we share health, medical, and scientific lifestyle knowledge in a friendly, easy to understand yet accurate way, helping everyone proactively protect themselves and their families from increasingly common health risks in modern life. High blood lipid levels, dyslipidemia, are silently becoming one of the leading risk factors for cardiovascular disease, stroke, and heart attacks. What makes this condition particularly dangerous is that it often progresses quietly, without obvious pain or symptoms for a long time, causing many people to discover it only after serious complications have already occurred. However, our bodies are not completely silent. In fact, as early as the morning, right after waking up, the body may already be sending warning signals if blood lipid levels are elevated. In today's video, Everyday Life will join you in exploring 8 of the most common early morning signs of high blood lipids, helping you take timely action through testing, adjustment, and prevention. 1. Fatigue and exhaustion right after waking up. Normally, after a full night's sleep, the body should feel refreshed and energized. However, if you wake up feeling tired, sluggish, and lacking energy, even without staying up late or doing heavy work, this may be an early sign of circulatory problems caused by high blood lipids. When bad cholesterol, LDL, and triglycerides increase, they accumulate on blood vessel walls, narrowing the vessels and forcing the heart to work harder to pump blood. As a result, less oxygen and nutrients reach the body's tissues, leading to persistent fatigue, especially noticeable in the morning. If morning fatigue is accompanied by shortness of breath, mild chest tightness, or rapid heartbeat, you should not take it lightly. 2. Chest pain or discomfort after getting out of bed. A dull ache, heaviness, pressure, or tightness in the chest right after waking up may indicate myocardial ischemia, a dangerous complication directly linked to high blood lipids. When atherosclerotic plaques form in the coronary arteries, blood flow to the heart is restricted, causing oxygen deprivation. This is often more pronounced in the morning when blood pressure and heart rate rise after sleep. Chest pain may last from a few minutes to several hours, radiate to the shoulder, left arm, neck, or jaw, worsen with light activity such as walking or climbing stairs. If these symptoms occur frequently, a cardiology examination is urgently needed. 3. Heavy head, dizziness, or lightheadedness upon sitting up. Morning dizziness, especially when sitting or standing up, is often dismissed as low blood pressure or lack of sleep. In reality, high blood lipids can reduce blood flow to the brain due to stiffened and narrowed blood vessels. When the brain receives insufficient oxygen, symptoms may include a heavy sensation in the head, pain in the forehead or back of the head, dizziness or imbalance, temporary blurred vision. If these symptoms recur over several consecutive days, especially in middle-aged or elderly individuals, they may be an early warning sign of stroke risk. 4. Facial swelling, especially around the eyes. Mild facial puffiness after waking can be normal, but persistent swelling around the eyes, cheeks, or eyelids that occurs frequently should raise concern. High blood lipids can lead to mild blood vessel inflammation, poor circulation, fluid retention in soft tissues. This causes fluid to accumulate overnight, making facial swelling more noticeable in the morning. If the swelling does not subside after several hours or is accompanied by fatigue or rapid weight gain, a comprehensive health check is recommended. 5. Blurred vision upon waking. Morning blurred vision, eye strain, or swollen eyelids may be related to fat deposits around small blood vessels in the eyes. High blood lipid levels make small blood vessels more vulnerable, reducing blood flow to the retina and causing temporary visual disturbances. These symptoms are often most noticeable in the morning and may improve after light movement. However, if blurred vision occurs frequently, lasts long, or is accompanied by headaches, it should not be ignored. 6. Cold hands and feet or leg cramps after waking up. Cold, numb hands and feet or calf cramps immediately after waking suggest poor peripheral circulation. High blood lipids narrow arteries supplying the limbs, reducing blood flow, especially after long periods of rest during sleep. This may result in cold hands and feet despite warm weather, muscle cramps or stiffness, a heavy sensation in the legs, if prolonged. This condition can progress to peripheral artery disease, increasing the risk of limb ischemia or even tissue damage in older adults. 7. Numbness or tingling in the legs. A tingling, prickling, or crawling sensation in the legs, especially after waking, may occur due to nerve oxygen and nutrient deprivation. High blood lipids impair blood flow to nerves, leading to sensory disturbances such as numbness when stepping out of bed, tingling or muscle tightness, reduced sensation in the feet. If these symptoms persist or worsen, early medical evaluation is essential to prevent irreversible nerve damage. 8. Morning nausea and upper abdominal discomfort. Morning nausea is not always related to stomach problems. In some cases, it may indicate cardiovascular issues, especially when high blood lipids reduce blood flow to the heart. Nausea may be accompanied by chest tightness, shortness of breath, cold sweating. If these symptoms appear suddenly and severely, immediate medical attention is crucial, as they may signal early stages of a heart attack. Important recommendations. Although these signs are not exclusive to high blood lipids, you should seek medical evaluation if they occur repeatedly, involve 2 or more symptoms, persist for weeks without a clear cause. Blood lipid testing, cardiovascular evaluation, and specialist consultation can lead to timely diagnosis and treatment. Early detection of high blood lipids helps reduce stroke risk, prevent heart attacks, protect long-term health. Dear viewers, our bodies constantly send warning signals. The key is whether we listen and understand them correctly. Do not ignore seemingly minor symptoms in the morning, as they may be early reminders helping us avoid serious health events in the future. If you found this video helpful, please like, share it with your loved ones, and subscribe to the Everyday Life channel to continue accompanying us on the journey toward proactive healthcare and a healthier daily life. Thank you for watching, and we look forward to seeing you in our next videos.